Good morning, everybody. Happy Tuesday morning with Missy Jenn. Getting ready for surgery today. And I've tried to put the word out exactly what Missy Jenn is having done today at here in Santa Rosa. She has had for the better part of a year, she has had something called a lipoma, which is a fatty cyst, and I've had them before in my arms and on my legs, very small ones. Well, she's got a very large fatty cyst there that has to be removed. The reason is it's below the skin. They don't really know what causes them. They're not that uncommon, but hers is uncommon due to the large size of it and the fact that it's on her side, at her rib cage. And as such, every time she sits down, it's pulling on her nerves, it's interfering with her nerves. It's giving her a lot of pain. So we're out here today. It's going to be removed. She's kind of a special case due to having MS, multiple sclerosis. It's really unpredictable when you have anesthesia. You know, it's too big to be removed by a local. Like all of my surgery, all of my liposuction, all of my Brazilian butt lift, that stuff was all done under a local anesthesia. I was wide awake for all those surgeries. Well, if you're really strong and you're really healthy, there's no problem at all for doing that. But due to the size of the lipoma, the location of it, they really need to make sure that Missy Jenn is out and that they can get in there and do a more invasive surgical intervention to remove that. So we're getting ready to go in. We're first here waiting for the doors to open this morning. Better to be early than late. I will keep you guys updated. We should be here like 5 or 6 hours or so. What they're gonna do is prep her, give her you know, something orally just to sort of, you know, not calm, but just keep her nice and cool and chill, and then they'll put her in and give her the anesthesia, remove the lipoma, and then she'll be in recovery. Have to have a anesthesiologist. You need to monitor the vital signs. You have to be very careful when there's things like MS, because MS, of course, is a flare-ups. It's the nervous system. It's the nerves attacking themselves and tearing the sheathing off of the nerve endings. And when it does that, you can imagine it's all raw, exposed nerves. Well, it can be in your brain, it can be in your spinal column. So you have to be very careful about control, involuntary things like breathing and heart. So you really need to have a super trained anesthesiologist that's on the job and able to do that. I will keep you guys posted later today when she comes out of surgery. So I want to thank you for being along this morning and being such great supporters of Missy Jenn. It's one thing we can all agree on. I might be a goofy gal and a real Class A troublemaker, but Missy Jenn's the real deal when it comes to kindness and everything else. Everybody loves Missy Jenn. Have a great morning, everybody.